most common conditions that I see that improve really well with a low carb, high fat diet, diabetes, obesity, type 1 diabetes even has less ups and downs in the blood sugars when you have less carbohydrate going into the system. Of course, someone with type 1 diabetes still needs insulin, but they'll need less of it. The other conditions that I see routinely get better: heartburn. I can take people off heartburn medicines almost uniformly after just a few days or weeks. Situations where there's a hormonal issue going on, like polycystic ovary syndrome, it turns out that a ketogenic diet is particularly effective in lowering testosterone levels in women with polycystic ovary syndrome. And in fact, several of my patients have become pregnant after failing drug treatment for fertility, getting pregnant after just a few weeks of the dietary change. So you have to be careful if someone doesn't want to be pregnant and they're not used to having to worry about contraception. You have to warn them about that. Most of the patients who come to me are young and actually want to become pregnant, so that's not an issue. But polycystic ovary syndrome gets better pretty quickly. Even the secondary characteristics of the excess of hair, acne, that sort of thing. Irritable bowel syndrome, very interestingly, the diarrhea predominant irritable bowel syndrome will be gone. Flatulence is gone very quickly. Other medical conditions that are not quite so solid but are being researched now, because insulin resistance is now seen to be a root cause of Alzheimer's disease, for example, and the low carb, high fat diet really fixes insulin resistance. There's a lot of interest in using this kind of way of eating to prevent Alzheimer's disease and even cancer. And this level of evidence is now being done in animal models, and compared to 5 years ago, there's been an explosion of research on the use of a low carb, high fat or keto type of diet. And I suspect that over the ensuing years we'll be able to use this, have indications for lots of other diseases. But up until now, the science is solid for the use of a keto diet for the treatment of obesity, for the treatment of type 2 diabetes, for the treatment of metabolic syndrome, the high triglyceride, low HDL, high blood pressure, high blood glucose, constellation of symptoms which are the root cause of atherosclerosis.